It started as a simple backache for John, a 45-year-old father of two. He'd spent the weekend helping a friend move, and the familiar, dull throb in his lower back felt like a predictable consequence. He took some pain relief, did a few stretches, and expected it would resolve in a day or two, just as it always had before. But this time was different. Within 12 hours, his legs felt strangely weak, and a new, worrying numbness was spreading through his groin. He ended up in the emergency room, where doctors realized they were in a race to save him from permanent nerve damage. John's ordeal highlighted 7 critical red flags that show your back pain might be a medical emergency. In today's video, I'll reveal these 7 warning signs that tell you to stop what you're doing and seek immediate medical help. The 7th one is a combination of symptoms that many people miss. So, make sure you stay with me right until the end. Let's start by understanding what's really happening inside your body. Most back pain, which affects nearly 80% of adults at some point in their lives, is what we call mechanical. It's a strain or a sprain. It's painful, but it gets better with rest and time. However, a small percentage of cases are not so simple. They are signals that something more serious is happening, an event that could lead to permanent disability if ignored. The challenge is knowing the difference. How can you tell if your backache is a muscle strain or a sign of a spinal infection, a tumor, or severe nerve compression that needs urgent surgery? My goal is to arm you with the knowledge to protect yourself and your loved ones. Because while most back pain is just a part of life, ignoring these 7 signs can change your life forever. So let's go through the 7 warning signs to look out for. Number 1. Loss of bladder or bowel control. This is the most urgent red flag. This isn't subtle. It could mean you suddenly have trouble starting to urinate, can't fully empty your bladder, or you have no sensation that you need to go. It can also appear as incontinence, leaking urine or stool without being able to control it. When John arrived at the emergency room, this was the symptom that immediately concerned the triage nurse. He felt a desperate urge to urinate but found that he couldn't, a condition known as urinary retention. This specific and alarming sign points directly to a serious condition called cauda equina syndrome. The cauda equina, which is Latin for horse's tail, is a bundle of nerves at the lower end of your spinal cord. These nerves control the function of your legs, bladder, bowels, and genitals. When something, like a large herniated disc, a tumor, or an infection, compresses this nerve bundle, it starts to shut down. This is a true surgical emergency. The pressure on these nerves is like standing on a garden hose. It cuts off communication. If that pressure isn't relieved quickly, the nerve damage can become permanent. While the timeline can vary, the risk of permanent damage rises significantly after 24 to 48 hours. This could mean lifelong leg paralysis, sexual dysfunction, and the need for a catheter. The doctors told John his inability to urinate wasn't just a symptom, it was a sign that the window for effective intervention was closing. So let's be absolutely clear. If you experience back pain with any sudden change in your bladder or bowel control, do not wait. Go to the nearest emergency room immediately. Number 2. Numbness or weakness in the legs or saddle area. The second red flag is closely related to the first and is another classic sign of severe nerve compression. This is the new onset of numbness, tingling, or significant weakness in your legs, groin, or buttocks. Doctors have a specific name for the numbness in the groin, inner thighs, and buttocks: saddle anesthesia. The name is descriptive. It refers to the areas of your body that would touch a saddle if you were riding a horse. If you have a strange or altered sensation or no sensation at all when using the toilet, that is a critical sign. This was the second symptom that worried John. He realized the strange feeling in his groin had become a complete lack of sensation. His legs, which had felt a bit weak earlier, now buckled when he tried to stand. This combination of symptoms, Saddle anesthesia and progressive leg weakness is another hallmark of cauda equina syndrome. The same compression that affects the nerves to the bladder and bowels also impacts the nerves that give strength and feeling to your lower body. The key takeaway is that the message from your brain is being blocked from reaching your legs and pelvic region. This isn't like a leg just falling asleep. This is a sign of acute nerve damage happening in real time. Weakness that gets worse quickly, like going from a slight limp to not being able to stand in a few hours, is a particularly dangerous sign. Much like with bladder changes, this symptom requires an emergency evaluation. Doctors will need an urgent MRI to see what is compressing the nerves and decide if surgery is needed. Ignoring this could lead to permanent difficulty walking or even complete paralysis from the waist down. Number 3. Back pain with fever and chills. This third red flag points to a different danger: infection. If your back pain is accompanied by a fever, chills, or night sweats, you cannot just assume it's the flu. This combination strongly suggests a possible spinal infection. A spinal infection can occur in the vertebral bones, which is called osteomyelitis, or in the intervertebral discs, known as discitis. It can also form an epidural abscess, which is a collection of pus around the spinal cord that causes severe compression. Unlike mechanical back pain, which often feels better with rest, pain from a spinal infection is typically constant, deep, and can even get worse when you lie down. The area on your back might also be warm, red, or swollen. This is a medical emergency because a spinal infection can erode the bones of the spine, leading to collapse. An abscess can grow quickly, compressing the spinal cord and causing the same devastating neurological symptoms as cauda equina syndrome. Treatment requires strong intravenous antibiotics and often surgery to drain the abscess and clean out the infected tissue. Delaying treatment gives the infection more time to cause permanent damage. So, if you have significant back pain along with a fever, don't take any chances. Get it checked out immediately. Number 4. Back pain following significant trauma. This one might seem obvious, but its importance can't be overstated. Any severe back pain that starts immediately after a significant trauma requires an emergency evaluation. This means a car accident, a fall from a ladder or down the stairs, or a forceful blow to the back. In these situations, you can't assume it's just a muscle strain. The main concern is a spinal fracture. When the force of an impact is greater than the spine's bones can handle, they can break. An unstable fracture is very dangerous because bone fragments can move and press on or even sever the spinal cord. For people with osteoporosis, where bones are already weaker, a fracture can happen from a much smaller event, like stepping off a curb awkwardly or even a powerful sneeze. First responders are trained to immobilize the spine of anyone who has been in a major accident and has severe back pain. This is to prevent any movement that could turn a stable fracture into one that causes catastrophic nerve damage. The rule is simple. If you have a major injury and experience significant back pain, numbness, or weakness, do not try to walk it off. Stay as still as possible and call for emergency help. A hospital visit is essential for imaging to rule out a fracture. Number 5. Severe pain that worsens at night or when lying down. This fifth red flag is a specific pattern of pain that is suspicious for something more serious than a simple muscle problem. This is back pain that doesn't get better with rest and, in fact, gets worse when you lie down at night. Most common back pain feels better when you get off your feet. Pain that wakes you from sleep is a major warning sign. This type of pain is a classic indicator of a possible spinal tumor. A tumor puts pressure on sensitive structures like nerve roots or the spinal cord itself. This creates a constant, deep, gnawing pain. Lying down can sometimes change the spinal dynamics and increase this pressure, making the pain more intense. Spinal infections can also cause this nighttime pain pattern. If a person has a history of cancer and develops new, persistent back pain, especially pain that is worse at night, doctors consider it a potential spinal metastasis until proven otherwise. The urgency here is to find the cause. A tumor pressing on the spinal cord can cause the same devastating outcomes we've already discussed. Number 6. A history of cancer with new back pain. We just touched on this, but it deserves to be its own red flag because of how important it is. For anyone with a prior history of cancer, the new onset of back pain must be investigated immediately. One of the first questions a doctor will ask when evaluating back pain is, have you ever been diagnosed with cancer? The reason is that some of the most common cancers, including breast, lung, and prostate cancer, have a tendency to spread to the bone. The spine is a very common site for these metastases. A metastatic lesion weakens the vertebra, making it prone to a pathological fracture, where the bone breaks under normal stress. These lesions can also grow and compress the spinal cord. The urgency here is twofold. First, the new back pain could be the first sign that a cancer has returned. Second, the neurological consequences can be swift and permanent. Early diagnosis and intervention are key. For anyone with a cancer history, new back pain is not something to watch and wait on. It requires an urgent medical consultation. Number 7. Back pain with unexplained weight loss. Our final red flag points to a serious underlying systemic disease, back pain accompanied by significant unexplained weight loss. This is generally defined as losing 5% or more of your body weight over 6 to 12 months without trying. When this symptom is paired with persistent back pain, it raises alerts for two main concerns: a hidden cancer or a chronic infection. Many cancers can cause a wasting syndrome that leads to loss of appetite and weight loss. If that cancer has also spread to the spine, it will cause back pain. Similarly, chronic infections like spinal tuberculosis can cause systemic symptoms like weight loss and fatigue alongside destructive back pain. This isn't about losing a few pounds after starting a new diet. This is about your clothes suddenly becoming loose and having a persistent backache that won't go away. This combination of symptoms warrants a thorough medical workup to find the underlying cause. It's a sign that your body is fighting a serious internal battle. So those are the 7 key warning signs: pain with loss of bladder control, numbness or weakness in the legs or saddle area, pain with fever, pain after trauma, pain that's worse at night, new pain with a history of cancer, and pain with unexplained weight loss. For John, the story had a positive conclusion. Because the doctors recognized the clear signs of cauda equina syndrome, they performed an emergency MRI which confirmed a massive disc herniation was compressing his nerves. He had surgery within hours to remove the piece of disc. Because he got to the hospital quickly and the team acted on the red flags, the pressure was removed before the nerve damage became permanent. His recovery involved intensive physical therapy, but today he can walk and has regained normal function. His story is a powerful example of why knowing these red flags is so important. Our final message is this: trust your instincts, and when in doubt, get it checked out. If you or someone you know ever experiences back pain with any of these 7 red flags, please seek immediate medical attention. If you found this information valuable, please share this video with anyone who you think would benefit from hearing it. Catching these signs early can really save a life. Thank you so much for making it to the end. I create weekly videos on everyday health tips, so please do consider subscribing and turning on notifications so you don't miss my future videos.